Dah climax tapi tak ada benda keluar.
Tembak kosong. Okay. Okay.
The most simplest reason I'll say for men, kalau katakan you muda-muda, you are going to have this problem. And most of the times kalau you tengok movie-movie macam what do you call American Pie.
It has to be less than 2 minutes without foreplay from penetration only. Okay? Then and ejaculate less than 2
macam
minutes.
tak ada build up lah.
No build up, nothing. You ejaculate within 2 minutes, yes, you have a problem. That's premature ejaculation.
# plastic bag hitam. Even kelenjar prostat pun kecil macam ni je. Very very small.
Yeah.
Dia bukan boleh simpan 1 gallon kan.
Dia bukan tangki tau. Dia kelenjar. Nama pun dah kelenjar, bukan tangki.
Okay.
We are having sex, okay, for example, okay, we are doing it and everything. Then after that, at one point we cannot maintain, tak boleh maintain ereksi tu, and the brain starts to send signal and be like, okay, I want to go down right now, you better ejaculate. Pop, the thing will ejaculate. So that's why it always will say that ED causes PE, definitely.
Kepada semua girlfriend, isteri kat luar sana, fast food, fast ejaculation.
Kalau nak beritahu siapa kan, you tahulah.
So kalau awak bawa suami you kepada drive-thru, maksudnya you akan kena drive cepat
Drive-thru.
If you're loving it, it's not going to love you.
Suruh lari marathon tapi dia buat pecutan.
Exactly. So,
Selamat datang kepada lagi satu episod Lesung Batu Medic Show. Topik perbincangan hari ini adalah ejakulasi pramatang, disebabkan bulan ni ialah bulan November, ialah Men's Health punya month. So bersama saya sekali lagi tim jejaka-jejaka Men's Health ni, Dr. Kevin, Dr. Debunking and also Dr. Sashi. So topik ejakulasi pramatang ni kadang-kadang disalah taksir. Sometimes ada isu premature ejaculation, sometimes ada delay ataupun quick ejaculation situation. Sashi, let's get the ball rolling.
Tak ada ejaculation.
Oh, lagi satu ada.
Dah climax tapi tak ada benda keluar.
Tembak kosong. Okay. Okay. Sashi, okay. Kenapa isu ni menjadi satu isu yang sangat serius kepada lelaki yang always ada isu macam mereka rasa takut that kalaulah saya dikategorikan sebagai lelaki yang mungkin pancut awal.
Fast finisher. There's one place that you tak nak cepat habis, bukan macam Usain Bolt
Okay, so kenapa benda ni?
Okay. Actually, before kita start tadi, kita bincangkan, benda PE ni sebenarnya is very, very complicated, nak katakan. Dia ada multifactorial. You guys know how deep this is. It could be, again, macam ED. It could be a few factors, a few reasons. The most simplest reason I'll say for men, kalau katakan you muda-muda, you are going to have this problem. And most of the times kalau you tengok movie-movie macam what do you call American Pie. You tahu di mana? Oh, all those guys are college guys, school guys and all those. Why does that happen? Gemuruh, gepuk, like an excitement is very very high.
You're nervous.
And you're nervous. So your dopamine level is like super duper tinggi. And that means something which is going to be the other way around, lower. Your gratitude serotonin level, which is not going to be properly functioning and also probably in a lower state. What happens? Snap. So that's going to happen. That is normal for any young man. Women, understand this Laki awal-awal, bukan semua laki kalau masa dia muda-muda, this premature ejaculation is going to happen at some point when they are younger. That is definite.
It's a process of pembelajaran.
It is a process of pembelajaran, and also the male glans penis is designed to be a bit more sensitive than the shaft and the other aspects, because that is the only mucous membrane yang exposed, and it is covered with the skin. For you who have not circumcised and tak buat sunat lagi, that is covered and closed, and it is increased sensitivity when it's covered and closed, and actually the sensitivity can say decrease to somewhat lepas sunat. Tapi walaupun dah sunat, it tak bermakna. No, it doesn't. Still can happen. So these are some of the physiological, atau dikatakan benda-benda yang biasa boleh berlaku kalau dikaitkan dengan PE yang bukan serius sangat lah.
Tetapi I nak tanya Dr. Kevin, kita always sedia maklum, sesama kita lah, sama ada orang perubatan ke sembang kedai kopi ni, you akan dengar, aku boleh main setengah jam, aku boleh main 1 jam. So benda ni logik ke tak? Tetapi I sedih sampai sekarang
Still got people.
Masih ada orang yang percaya benda ni.
30 minit.
Masih ada professionals in our field memberikan this kind of narrative that, oh, you know what? Kalau you tak boleh main this amount of time, you tak power. And it's something very subjective.
Correct.
And you judge yourself based on it.
Betul. Why? This 30 minutes issue ni, 1 jam ni. Mereka nak main 90 minit punya game.
Actually, this 30 minutes issue, I think it's completely a fake thing, and it's not even true at all. Actually, even in the books, in the textbook and things like that, so they will always say a normal physiological for a man, okay, to ejaculate lah. It's most probably like 2 to 5 minutes without foreplay, without foreplay, just pure penetration saja. It could be up to 6 or 7 minutes, depending on stamina wise and things like that. But 30 minutes is a no-no.
Actually, in fact, more than 15 or 10 minutes or 15 minutes, dikatakan prolonged ejaculation tadi.
Ada masalah.
Yeah, ada masalah already.
Coming to that, I think AUA already classified lah. American Urology Association already classified. Normal ejaculatory latency time, IELT, okay, intravaginal ejaculation latency time, it is 5 to 20 minutes. Okay. Now, when you say 5 to 20 minutes, if someone tends to ejaculate, let's say, between 3 to 5 minutes, you still don't consider them as having premature ejaculation.
Betul.
Correct,
Because to say someone has premature ejaculation, it has to be less than 2 minutes without foreplay from penetration only. Okay? Then ejaculate less than 2
macam
minutes.
tak ada build up lah.
No build up, nothing. You ejaculate within 2 minutes, yes, you have a problem. That's premature ejaculation.
# plastic bag hitam.
Okay? If you say you can play for 30 minutes, sorry, you don't have PE. True, you don't have PE. You have delayed ejaculation now.
Betul.
So that you're trading off one problem for another. lah.
Correct.
Yeah.
So and saya selalu katakan kalau lah penetrasi tu boleh berlaku selama 30 minit atau 1 jam.
Penat.
Satu penat. Satu lagi macam I akan challenge lelaki tu kata I nak main setengah jam doktor. I said jom
Boleh berapa shot tak?
bangkit daripada you punya table, daripada kerusi saya ni. I nak tengok berapa push up boleh buat.
Yeah, we always do that.
Yeah.
We always start.
You boleh buat 5 minit push up non stop. I rasa macam Pascal pun tak boleh buat 5 minit non stop. So psychologically, physically, sasa badan tu pun tak boleh. Your brain akan tap you out.
Yeah.
Your brain akan tap you out because dari segi apa posisi you buat pun, your brain will tap you out because you cannot condition unless your stamina, your breathing and everything lain.
Yes.
Tak boleh. And another one more thing I nak tambah, so, setengah jam, trust me, Faraj akan koyak.
There's a possibility of having injury.
Jadi kertas
It
pasir.
becomes more painful because there's no more mucus vaginal secretion anymore. Yeah.
And pengeluaran macam air mazi pun, kelenjar tu dia bukan macam ada satu baldi kat
Bukan
belakang.
ada pipe kat belakang.
Kelenjar tu sangat sedikit.
Yeah, dia kelenjar.
Even kelenjar prostat pun kecil macam ni je. Very very small.
Exactly. Yeah.
Dia bukan boleh simpan 1 gallon kan.
Yeah. Dia bukan tangki tau. Dia kelenjar. Nama pun dah kelenjar, bukan tangki.
Okay. Nervousness dan juga sistem saraf. Because benda ni melibatkan signaling. Some people mungkin ada masalah saraf. Some people mungkin terlampau sensitif. Mungkin ada isu yang macam sakit tulang belakang ke apa. Boleh melibatkan PE berlaku. You agree?
Of course. Dan tadi saya beritahu sebab-sebab tu adalah fisiologi atau dikatakan secara semula jadi atau natural. Benda yang bukan dikatakan sebagai patologi atau masalah kesihatan. Itu physiological. Okay, dari segi like your excitement, dari segi your kepala zakar yang lebih sensitif dan sebagainya. This is something that will take time. Tapi kalau kita pergi kepada masalah di mana patient datang, dia kata, doktor, dulu saya okey, tapi sekarang dah already shorten the time of ejaculation. Then we have to think about pathology already. Sebab biasanya orang yang datang bagi tahu ni mungkin dalam lingkungan umur 40-an ke atas, 50-an. This is when you can also think about sama masalah yang kita katakan pasal mati pucuk dan sebagainya, disebabkan oleh saluran yang tak bagus. Same thing. Kalau your blood flow is not good and your erection is not going to be able to sustain, your plane is going to crash.
Yes.
Eject, keluar. Or, one more thing, crash with the plane. That means you go down having a low erection di mana macam Dr. Diman katakan tadi, poor maintenance of erection is not there. So what will happen is you tak ejaculate, you go down with your whatever. You tak keluarkan air mani lah.
Dia macam situation abandon ship.
Abandon lah. So you just go down with that. So this is when dah boleh katakan sebagai bahagian di mana there is some concern pathology. Either dari segi jantung, one thing, your stamina is going down already, and tak ada ubat yang boleh tinggikan stamina. Guys, mana-mana pun takkan wujud at any point in time in life di mana ubat ni makan ni, stamina you mesti power. Takkan ada. Will never happen. Kalau macam tu, Usain Bolt sampai sekarang makan ubat kita dah.
And balik kepada this question, I think I'm going to ask both Kevin and Deben is masalah pancut awal. Adakah isu ni memang berkait paut dengan erection ED juga?
Okay. So bila kita bincang tentang masalah ejakulasi pramatang atau kita sebut biasanya pancut awal lah. Okay. Pancut awal exist dalam dua cara, in two forms lah. Okay, satu lifelong. Lifelong maksudnya daripada kali pertama you mengadakan hubungan seksual, okay, kali pertama you boleh kaitkan okay, rasa gemuruh, nervous dan sebagainya. Tapi lepas tu dah kahwin, dah biasa dengan pasangan pun sama juga. Less than 2 minutes you dah ejaculate. Okay. Tapi you tak ada masalah erection. Okay. Tak ada erectile function, dysfunction apa-apa, tak ada mati pucuk. Tapi you ada masalah ejakulasi pramatang. That is lifelong. Okay. Yang tu tak bersangkut paut dengan masalah mati pucuk dan sebagainya lah. Yang tu lebih kepada threshold, your orgasm threshold for orgasm lah in your mind. Okay. Yang satu lagi ialah kita panggil acquired PE. So acquired premature ejaculation ataupun ejakulasi pramatang yang disebabkan oleh faktor-faktor lain, faktor-faktor kesihatan. So antaranya ialah masalah mati pucuk lah. So macam Dr. Zazi cakap tadi, masalah mati pucuk, tak ada suka nak kekalkan ereksi, suka nak kekalkan ketegangan zakar yang cukup. So minda akan rasa okay, sebelum aku hilang ketegangan ni, baik aku ejaculate dulu.
Kevin?
I totally agree with Dr. Deben actually. Correct, true actually. So if let's say we are having sex, okay, for example, okay, we are doing it and everything. Then after that, at one point we cannot maintain, tak boleh maintain ereksi tu, and the brain starts to send signal and be like, okay, I want to go down right now, you better ejaculate. Pop, the thing will ejaculate. So that's why it always will say that ED causes PE, definitely.
Betul. Yeah. And another one more interesting thing also to say that bila kita lihat kepada even the sexual perspective, kadang-kadang ada individu yang memang fit, macam Dr. Deben katakan, mereka boleh pergi beberapa kali. The recovery is very fast because of the fitness, because the nitrous oxide punya position, their physical fitness, and dia tak ada masalah. Tetapi timbul juga masalah yang mesti katakan Kevin tadi is we also see satu lagi community lelaki ni, dan bila I tanya dia, Tuan, you boleh pergi berapa round? And then he will tell me like, Doktor, I hanya 1 round je boleh. And then like, how about like after 6 jam ke, lepas you tidur you bangun ke, also tak boleh, mungkin the next day. So that one memang kita nampak another perspective. So memang akan ada juga wujudnya some form of disappointment dalam pasangan tu, because like mungkin kalau foreplay tu tak legap, tak ada climax dari segi diperolehi oleh pasangan wanita tu, and then you pancut awal and then like I have to wait 6 hours. That is frustrating.
So just to add on, again, when we talk about acquired PE, right? Pathological PE lah. Okay. So acquired PE, one is of course mati pucuk, satu. Yang kedua ialah sama juga dengan masalah mati pucuk, hormonal imbalances. I bukan nak cakap kekurangan testosteron, but hormonal imbalances juga, ketidakseimbangan hormon lah, juga dikaitkan dengan masalah pancut awal. Okay. Dan yang satu lagi ialah kekuatan otot-otot pinggul lah, pelvic floor dysfunction. Yes. Okay, I think in a lot of males, especially sedentary lifestyle, obesity, okay, duduk sahaja, masalah otot pinggul yang lemah juga mendatangkan masalah ejakulasi pramatang lah, sebab otot pinggul tu tak dapat menahan prostat daripada mengeluarkan air mani. Okay, itu satulah, itu yang kedua. Dan your on issue of nak pergi round 1, round 2, okay. So a lot of people don't understand. They think, a lot of men, the idea is you ejaculate within the next 20 to 30 seconds, you're back up for round 2. Okay, that doesn't happen. It's not a must for everyone, because how long it takes you to go to round 2 or round 3 is dependent on a hormone called prolactin.
Betul.
Alright, so prolactin, of course, there's a surge of prolactin. Prolactin meningkat bila you dah ejaculate. Correct. Okay, berapa lama prolactin tu ada dalam sistem, dalam badan, okay, untuk dia turun ke paras normal is different for every man. But what can be seen is that as kita semakin berumur, higher amount of prolactin stays in the body. Number one.
Untuk makluman semua di luar sana, prolaktin ialah satu hormon yang biasa kita dengar dirembeskan semasa ibu tengah menyusu.
Menyusu
lah.
Tetapi dalam situasi ni, kenapa rembesan prolaktin tu berlaku is untuk menghalang ataupun is a refractory period to rest the body.
Exactly.
Lepas because hubungan intim tu is very intense. It's a very
very stressful activity.
Good stressful activity. Yes. Tapi macam Dr. Roland katakan, memang dia akan tinggi selepas ejakulasi. Okay. One more thing that I want to add. Refractory period atau nak katakan recovery period ni bergantung kepada beberapa benda. Faktor usia. Semasa you muda, mungkin you rasa, I boleh refractory period, I kurang. You boleh recover dalam 20 minit. Yes. In your teenage and 20s, refractory period you sangat rendah because your body's recovery. Ingatkan masa saya bagi tahu in the previous episode, your recovery is very good when you're young.
Betul.
Okay. As you hit umur 30-an dan 40-an, your refractory period mungkin
a bit longer,
berjam. And as you hit 50s and 60s, mungkin ambil 1 hari to recover atau 12 jam dan sebagainya. Again, macam you katakan, depends on your physical activity and how good, strong you are physically. Okay. Now the prolactin dia dah tinggi. What actually brings it back to a level which is normal is oxytocin. Okay. Kalau oxytocin atau nak
This is
katakan
the
love hormone.
Yeah.
And this is where after your activity, that the hugging, the lying down and the talking and chit-chats and all those actually helps with bringing down this thing. And also the oxytocin, as I said, will lower the prolactin level dan benda ni akan reset balik lelaki tu. Tak macam perempuan lain. Once you are in multi orgasm is something which is prevalent. I mean, it's normal in women. And this different untuk lelaki dia.
Lelaki ni climax dia macam bagi tahu dia macam roller coaster. Dia naik, boom, crash.
That's all. Dia tak ada multifactorial, multi-sport dan sebagainya, tak ada. Okay. There is possibility of arousal from different sport, but orgasm from different spots is unheard of in men. Okay, almost none. Alright. So for women, sekali
it's so easy, right?
Yeah,
for me.
So once you have reached your climax, you are able to have multiple orgasm in times because of different factors and different spots that can actually trigger this orgasm. Tapi untuk lelaki lain. So jangan bandingkan lelaki dengan perempuan macam tu. So women have to understand that men are not the same. It's different.
Mungkin kena tambah sedikit to what Dr. Shashi katakan. When we look into that psychology, bila kita lihat pada hormon oxytocin tu, it's like kita lihat sebagai hormon kasih sayang lah, of the lovey-dovey hormone. Bila this ejaculation happen too fast, terlampau cepat, the other partner become frustrated. And then the war begins. Correct. So there's no lovey-dovey hormone. So it goes in one episode, next episode, 1 month, 2 months, 3 months, and then the fear becomes. And then because this signaling ni untuk ada, see, ejaculation is point and shoot. We know dalam our basic nervous system, parasympathetic, sympathetic. So ejaculation is still sympathetic. So when you are stressed, you will ejaculate.
Yes.
So ejaculate. So bila the stress is dari segi from the position, from the discussion, the intimacy, the sweet talking, all of this is very complex.
Yeah.
Dia bukan even macam main bola apa-apa. It's so many component menyebabkan benda ni berlaku.
And
anything on that?
Yeah, I totally agree to that. So that's why I said, everyone kalau nak cakap pasal hubungan intim, dia bukan direct towards the penetration only. There's a lot of other factors that can actually work on improving your ejaculation, especially like for women. You have to, like, I think we'll discuss in another segment because this segment is about male. So we
Women's Day nanti.
Women's Day nanti kita, sekarang no nut November, so lain sikit.
Kita bawa lelaki juga.
So we will, we'll discuss that. But there are ways and technique di mana anda boleh melambatkan in terms of breathing. So many factors that you can, like Dr. Deban said just now. Faktor-faktor yang lebih fisiologi atau boleh dikatakan bukan patologi, boleh diperbetulkan teknik pernafasan, your pelvic floor exercises, your Kegels, like even kemut. when you masa kencing, air kencing tu, the kemut lepas that
that's
is
a
one
form of Kegel exercise.
Yeah, it's a form of Kegel exercise. Okay,
So otot pelvis ni agak-agak besar.
Yeah.
the pelvic floor muscle is actually quite complex. I feel we always talk about the pubococcygeus muscle, PC muscle. So tapi dia ada actually banyak lagi di sekitar that zone tu yang boleh dikuatkan dengan some simple exercises, right? So there's a lot of other factors that you can take into account to do this. Just don't give up.
Even those yang ada masalah ejakulasi pramatang pun there are a few techniques you can practice with your partner that helps you over time to improve the outcome lah. And this is again physiological. Kalau dia bukan pathological, bukan daripada masalah lain. So things like stop and squeeze technique. So bila you rasa you nak ejaculate, you berhenti, you tarik, you pegang kepala Zaka sampai rasa nak ejaculate sudah tak ada, then you sambung balik. Cuma masalahnya you kena bincang dengan you punya partner dulu. Cakap okay, first is you have to acknowledge that you have this problem. Then you talk to your partner and then you practice all these techniques lah. But the best thing you can do, see a sexual therapist. The problem is most males, they don't want to see a sexual therapist.
Yes.
If it can be cured with a pill, I rather take the pill than see a sexual therapist.
No one knows.
Yeah, and no one knows also that there is
Not
a sexual
being judged.
therapist.
That's what they're scared of.
Exactly.
So akan timbul also another one more thing yang kita lihat when lelaki segan untuk dapatkan to come and see us or whoever untuk berkenaan isu ni sampai isu ni jadi serius. Because bila ada isu kepuasan tu tak dapat reach, then it becomes frustrating.
Correct.
In
Like Kevin said lah, jangan tunggu sampai
Betul
sampai dah isteri dah gertak you dah apa. So the first thing is untuk kaum wanita,
Point blank.
laki first of all, be trusting of your partner. Go and open up, tell this is an issue that I'm having. Communicate.
Yeah, communicate.
And then and for women, don't judge based on it. Dia bukan kurang lelaki atau sebagainya. There's one problem that he's having. Despite all the benda lain, like the loving, whatever, and all those hopefully yang dia buat,
tetapi wujud juga satu situation di mana the wrong expectation datang kepada pasangan. Okay, let's say katakan lelaki ni tak ada apa masalah. I mean, he can perform mungkin dalam 3-4 minit and everything. Fit guy, below 30 years old, fit. Tetapi disebabkan oleh pornography content or the viewpoint of pasangan dia, like, oh lelaki ni kena main setengah jam. Because this narrative telah diletak outside there, and
So really the mindset like that.
and the media don't want to debunk this.
Yeah,
No
it makes it
one
worse.
want to come and debunk this because why? There's so much of money to be made
yes.
in this thing.
When there's a problem, who's making money out of it is when you have to think about it.
Because kalau kita boleh letakkan lelaki and tell them, you know what, you're weak. Even though it's something illogical, it's something to capitalize on them in the mindset. It's damn deep.
It's actually capitalizing on a problem.
Do you see this or not as a thing? Kevin?
Yeah, I see. Because like we cannot, how we want to, have sex for like 30 minutes and stuff like that, it is so like
impossible.
Unrealistic.
I had a patient in his not even his mid-20s, very early 20s, okay, just turned 20, 21, something like that, right? Came in, his primary complaint is not, I cannot last. His primary complaint is, my girlfriend says I cannot last. Okay, I said, okay, fine. How long does it take you to ejaculate? He said, 25 minutes. 20 to 25 minutes. He even timed it. He takes me about 20 to 25 minutes to ejaculate. And he said, your girlfriend is saying that is not enough. Okay, I think here the problem is not you. Okay, the problem is the expectation that is put on you, which is not realistic. It is not a realistic expectation. Now the problem comes in because our primary source of information is again pornography, which is sexual knowledge is again pornography. Why? Because our upbringing, we don't want to talk to our parents. We don't talk to anyone.
Parents don't
want to talk to you about
Teachers
this.
don't want to talk about it.
Teachers don't want to talk about it. There is lack of education in school or anywhere. So where are you going to look for?
And because of that, teenage pregnancies, whatever, and also a multitude of problems. Banyak problem. Bukan masalah tu je, banyak problem. And
even you talk about that, the concept of condom per se is for prevention of pregnancy, not prevention of STDs.
Yeah.
Betul. And bila kita lihat kepada that same component and we seeing that okay, the expectation ni macam melangkaui batas.
Yeah.
Also comes another perspective of some men yang akan datang kata like, adakah disebabkan I onani pada usia yang muda.
Masa muda.
And this thing is like a
that's
curse.
another common one.
Do you get that?
Yeah, got it.
Why, do you think it's true or not?
No, it's not true.
Yeah.
I want to add something
You wanna
before we go to that
add-
point. Now, we are talking about how all these masalah-masalah yang ada kat lelaki ni disebabkan oleh gaya hidup dan kita punya katakan vaping ke dan sebagainya lah. Apa you makan, apa you minum dan sebagainya. Kencing manis, darah tinggi. You guys rasa benda ni tak ada efek kepada perempuan ke? We never thought about that. We haven't touched that point. Now, untuk masalah lelaki, kalau katakan ejakulasi pramatang, untuk perempuan most of the times is delayed climax.
Yeah.
Sebab blood flow kepada bahagian faraj anda dah semakin kurang, nipis. Mungkin ada masalah kadang-kadang air mazi yang tak cukup, dry vagina dan sebagainya. Also, that is some problem. And masalah yang most common, dia kata, I boleh tahan 30 minit. It's actually not a good thing. If you can't hit your climax, same as what he said earlier, the American Urological Association, which is also covering for women as well.
Yeah.
If you are unable to climax in the gynecological text, if you are not able to have your orgasm,
In this time of
that means it could be physiologically women are not able to attain orgasm, or the other thing is that is not their spot, or the other thing is this lifestyle activity yang you pilih ni boleh menyebabkan you tak dapat climax dengan masa yang normal. This is the other thing.
Tapi you know I always say this, it's very easy to blame the guys because it's something that you can see.
Yeah,
Yes.
exactly.
But in a female perspective,
No one talks about
you cannot
about
see.
this.
You gotta
Yes.
ask like, oh, did you reach?
They may not even know that is a problem.
Yeah.
Yes.
Yep.
Yes.
And terus terang, I think personally, I think Shashi, myself, I mean all of us will agree. Sometimes when kita buat blood screening ataupun wellness screening for female, and even when we do it during the waktu ovulasi, the
Estrogen is-
level of estrogen kadang-kadang kita fikir, why so young and why so low?
So low.
So low.
Yeah.
So it is almost like when there is no, that means we always say like, oh, low testosterone, but nobody talks about low estrogen. Estrogen.
Or low progesterone.
Yeah. So all of that also actually affecting the body. Like how testosterone tu satu hormon yang penting untuk lelaki, estrogen tu satu hormon yang sangat penting pada wanita.
Yes.
And kalau pemakanan tak bagus and everything that actually menggalakkan your senaman and everything,
You will be affected.
you will
Apa
lose
yang affect lelaki,
that
affect perempuan
estrogen
juga.
straight in the thing. I nak go to Dr. Shashi again. We talked about it's not the serotonin and dopamine. And
Okay.
I remember once you talking about how important the gut health is to this. Into this premature ejaculation thing.
Okay.
Apa sebenarnya berlaku dalam perut?
So saya pernah buat video lama dulu, di mana saya lukis 3 circle. 3 hormones which are very 3 neurotransmitter lah, saya kata hormone lah, neurotransmitter. Which is basically dopamine, serotonin, and one more thing is cortisol. Okay, this 3 is in play when you are in an intimate position in a sexual manner and all those. These 3 play a role where a lacking of one can cause either when the dopamine is too low, there's no excitement. So you won't even get the erection in the first place.
Boring
The boring partner like that. You know, that's one thing. The dopamine thing. The cortisol is when you are not even able to even think about it. Okay? But in a good level, during sexual performance, the cortisol actually rises. Okay? And serotonin, which is call it the gratitude hormone, and most of it, serotonin is, kalau kita nak tengokkan, kalau masalah ejakulasi pramatang, they'll give you something which is also given to people who are having problems with depression, which is your depoxetin. And benda ni sebenarnya cara dia berfungsi adalah untuk dia panggil SSRI, di mana dia akan menyebabkan penggunaan serotonin ni dengan cara yang reuptake inhibitor. So dia tak digunakan semula and it is kept within this circuit lah. Dia tak keluarkan benda ni daripada
itu adalah salah satu rawatan yang kita gunakan.
Rawatan yang kita gunakan. Okay. What were you saying again? The
serotonin, that mean your
so the gut health ni, di mana serotonin ni dihasilkan? Walaupun dihasilkan di otak, long time we thought that it was produced in the brain, but we understand that the trigger comes from your small intestine, and the things that actually benda dalam usus kecil ni, small intestine ni, yang menyebabkan serotonin ni dalam keadaan yang normal and normally dirembeskan seperti biasa adalah your normal gut flora. kalau bakteria baik dalam perut kita ni kekurangan, di mana dia akan caw daripada you punya perut kalau you makan semua benda-benda yang terproses dan sebagainya, gula yang terproses, no exercise, no connection to your mind and body, benda ni akan keluar daripada badan you just like that. Okay, and this in fact means that your serotonin production, your 5-HTP GABA, that whole pathway is going to be affected. You dah tak ada benda tu. Of course, the SSRI of course will work in maintaining whatever serotonin that you have. Tapi hakikatnya, in the long run, you have to take care of your gut health.
So, makanan apa yang menyebabkan gut health tu jadi sampah ni? drum roll, aku nak dengar.
All your benda-benda tepung-tepung, all your processed minyak. Seperti margarine, you know, like margarine is one of the non-natural fats. Kekurangan pemakanan lemak yang baik, seperti ghee, butter, yang di mana biasanya kaitkan dengan kolesterol tinggi dan sebagainya. Total mitos ni. So you have to have this, and of course makanan yang lebih natural, daging, sayur, all these things, and also peningkatan pemakanan seperti your bijirin yang diproses, either soy, wheat, barley, beer, all this anti-testosterone dan juga what do you call this, bakteria-bakteria baik ni. In fact, you can say anti-testosterone juga. This kind of foods, right? This is anti this kind of because it doesn't work for good cholesterol. Cholesterol is the main precursor for all your hormonal function, the hormones in your body. Benda tu induk. Kalau tak ada benda tu, then you won't produce proper levels. But
no
also
cortisol, no testosterone,
everything, progesterone, estrogen, everything else from there. That's the induk. So this fellas makes the gut bacteria ni happy to stay. Kalau benda ni tak ada, gut bacteria ni mungkin boleh jadi benda yang tak baik untuk badan kita. Dia mungkin attack kita punya sel badan, di mana you akan dapat IBS, indigestion dan sebagainya. Gastrik katakan. Biasa orang kata gastrik disebabkan oleh acidity yang tinggi dalam perut. Kalau perut tak acid, benda tu bukan normal. Kalau perut you tak cukup acid, that means you're going to have indigestion. And pemakanan ubat-ubat untuk mengurangkan keasidan perut ni untuk jangka masa yang panjang ada efek yang teruk. Your stomach is acidic for a reason. To kill the bacteria which is going into your body, and also untuk first breakdown of your food.
So, I think I ada satu message kepada semua girlfriend, isteri kat luar sana. Fast food, fast ejaculation.
Kalau nak beritahu lah siapa kan, you tahu lah.
So kalau awak bawa suami you kepada drive-thru, maksudnya you akan kena drive cepat.
Drive-thru.
If you're loving it, it's not going to love you.
Dr. Kevin,
yes.
Kita lihat again in all of our media masa and everything kan, because issue ni sensitive, and a lot of people hijack this by selling things. Macam mereka jual minyak lita,
candy bee,
gambe, whatever lah, macam ada. And they use this kind of cheeky kind of terms. Oh, abang takkan cepat muntah and all of this kind of things. A lot of this kind of things kita tengok pun sekarang menyampah. Like, come on, do it professionally. Ada tak barang-barang yang memang kita boleh pakaikan and bekerja ke this kind of product, minyak lintah, gambe and everything? Adakah any form of dia boleh membekalkan some form of kekebasan, ataupun maybe again like episode lepas Dr. Dibon kata it could be just a placebo effect.
Yeah, I think right now, right, a lot of patients, right, they will come, you know, they will say that doctor, saya pernah guna this spray lah, this minyak lintah lah, candy bee, tissue lah. I'm like, what? Tissue can help to what? Kepaskan what? The problem is that we don't know what content inside.
Betul.
That's the thing. And don't know what chemical inside.
Tetapi mereka akan kata, oh, benda ni berdaftar and everything. So because mereka pergi daftar bukan as a drug, tetapi mereka kata daftar as a mungkin supplement ke, gula-gula ke, macam tu.
Correct. And also all of this will cause like a bit of sensitivity towards the skin, you know, allergic and things like that, and it will cause the condition to be somewhat worsen.
Kalau kita tahu where is the root cause.
Root cause, yeah, that's the thing. So please don't do any fast track of buying any tissue magic or whatever minyak lintah and all. It's all fake, I'm telling you.
Okay,
seriously.
so tapi I want to jump to Dr. Dibon. We know we all can treat this kind of issues. Okay, how do we treat? Macam mana kita nak rawat? Memang ada rawatan. Bukan nak katakan tak ada rawatan yang di luar sana untuk lelaki yang ada masalah ni. Memang kita boleh bantu, because bila kita bantu sedikit dari segi rawatan, we actually improve the psychology in the long run.
Right. So
Apa yang ada?
okay, so first thing is we have to find out lah, kita kena cari apa punca masalah dia. Okay, so macam saya cakap tadi, one is sama dia lifelong PE. So kalau lifelong premature ejaculation, dari awal dah ada masalah ni, then rawatan adalah lebih kepada psikologi satu. Okay, there is a small percentage where seseorang tu, lelaki tu boleh ada hypersensitivity of the penis. Maksudnya any form of stimulation, apa-apa stimulasi kepada zakar boleh mendatangkan ejakulasi, pancutan. Okay, be it sexual or non-sexual lah. Okay, kalau macam tu, then of course there are treatments like called nerve ablation ada, or the easiest thing is your spray lah, your lignocaine spray, lignocaine gel.
So dengar,
krim kebas
lidocaine tu ialah satu
ubat kebas.
Ubat dalam Akta Dadah Malaysia yang kita gunakan untuk membekalkan some form of kekebasan.
Exactly.
Okay? Kita memang guna secara sah dalam perubatan. Okay, and you boleh dapatkan dengan doktor-doktor you.
So yang tu kita boleh gunakan kalau masalahnya adalah rangsangan ataupun tahap rangsangan yang melampau. Okay, then dekat situ dia boleh digunakan lah, tapi dengan nasihat doktor lah, ada cara nak gunakan. Okay, itu satu. Kedua, kalau dia premature orgasm, then of course SSRIs yang macam Dr. Syazid cakap boleh digunakan lah. So Depoxetine, Paroxetine ada. Ada beberapa jenis ubat tahan sakit juga yang boleh mendatangkan masalah. Yang boleh membantu
tetapi memberi masalah.
Lebih bermasalah sebab masalah addiction. Okay. So yang tu kalau boleh kita tak guna lah. Kita tak mula pun. Kalau boleh kita tak mula pun. Okay. So ada ubat-ubat yang lebih selamat macam Depoxetine dan Paroxetine yang boleh digunakan. Itu kalau untuk premature orgasm or lifelong PE. Acquired PE, contoh masalah pancuk awal disebabkan oleh ataupun datang bersama dengan masalah mati pucuk. Rawat yang mati pucuk dulu. Okay, sebab kebanyakan macam hipotesis kapal terbang yang nak menjunam. Okay, kalau you boleh elakkan kapal terbang tu daripada menjunam, tak ada keperluan untuk eject the passenger kan?
Untuk
exact.
Ini pilot pun dive sekali.
So you treat the ED first lah. You treat the ED first. Other than that, of course, if you're talking about pelvic floor dysfunction, all that, your Kegel exercises, all that help. Okay. Bersama ni semua, of course, your sexual therapy, your techniques, getting back to the basics of romance, all this helps in treating your premature ejaculation as well. I think that's about it lah. And then, of course, coming back, I wanted to come back actually to your point on masturbation. Beronani. Adakah beronani mendatangkan masalah pancuk awal? Ya ataupun tidak? Okay. Kebanyakannya tak. Okay. Tapi ada di few instances when someone is a compulsory or obsessive masturbation. Okay. You're talking about 3-4 times a day. I've seen patients who masturbate about 5-6 times a day.
Yes.
Okay.
That's damn bad.
Alright.
Wow.
When that happens, when someone does that, okay, masturbation per se or onani tu tak mendatangkan masalah dari segi fizikal. But what it does, it changes your mindset, perception of sexual gratitude or sexual gratification. Maksudnya, seseorang tu kalau beronani berlebihan akan cuma boleh mendapatkan nikmat seksual daripada aktiviti tu sahaja. Dan bukannya daripada aktiviti bersama atau
dengan orang, dengan pasangan.
Exactly. Yeah. So dia perlukan rangsangan yang sama. Contohnya daripada beronani baru boleh ejaculate. Itu satu. Tapi bila nak kaitkan dengan masalah premature ejaculation, okay, beronani selalunya seminit 2 dia dah boleh mengeluarkan air mani. Okay. So zakar dah terbiasa dengan masa itu.
Correct.
Okay, so bila you mengadakan hubungan seksual, okay, dan rangsangan tu seminit 2 dah mencukupi untuk mengeluarkan air mani.
So macam ni lah, dia macam suruh lari marathon tapi dia buat pecutan.
Exactly. So dekat situ pun rawatannya adalah lebih kepada you address the masturbation part and not anything else lah. Over time, but of course everyone wants a fast cure. The problem is there is no fast cure.
Betul. And then mungkin I nak tambah sedikit apa daripada Dr. Diban tadi. Bila kita lihat kepada masalah onani ni juga, this sprint laju sangat ni dia lah terbawa in the physicality. So the body from the start has already adapted. Mungkin you see the average sexual activity only develops like significance when they have most likely a pair, ada pasangan. Tapi sebelum tu mungkin ada this influence of onani and masturbation. And this thing maybe would be happening like 5-6 years. So you have like a pre-developed perspective in the brain. Oh, this is this. And another one more thing is the hand is faster than the hip.
Yes, definitely.
Correct.
Definitely. This is another one more thing yang tangan tu lagi laju daripada pinggul.
And so I would like to just to this one that kita bukan nak bagi tahu onani ni tak baik, tapi di sebaliknya kalau I would say that your first sexual experience for most people is through onani, laki ke perempuan, and it's safe, it's you experimenting dengan badan you, tapi ia menjadi masalah macam Dr. Diman katakan, dalam sehari orang buat 5-6 kali addiction. Atau dalam seminggu setiap hari you kena buat, kalau tak you tak boleh. This is when you bergantung, you jadi macam addicted. You boleh addicted kepada benda ni, either pornografi ke tak ada pornografi ke, tapi you kena onani, then it will become something that you akan associate yourself. Benda ni biasa dah. Kalau tak boleh ada benda ni, I tak boleh macam normal. Macam anything. Could be rokok, could be alcohol, could be anything. So even this, kalau digunakan sebagai addiction untuk for you to escape something, then it is a problem.
And another thing to add in bila kata perkataan addiction ni, dia macam ni, the person who is most likely to smoke is most likely there is a probability to consume alcohol lagi tinggi. Probability untuk to take recreative drug is high. Probability for this kind of masturbation is high. It's just like goes up. Like your band goes higher.
It depends on what your addiction. What are you addicted to?
It opens up when you're addicted to something. There's higher chances of you being addicted to something else.
Yes,
possible. Possibility. And also in long term, you have to understand that your hand is tak sama dengan alat kelamin wanita.
Betul.
So kadang-kadang you rasa you mungkin mati pucuk. Sorry, going back to the old topic. Mati pucuk. Tapi kalau you onani okay je. Itu satu lagi benda di mana blood flow you dah macam and your psyche is already tuned towards watching this is giving me stimulation, and using my hand is giving stimulation, as compared to you kena bergerak. Sex is different, you have to move, your pinggul is different as compared to your tangan. All that means that your erectile dysfunction or P could be associated with something which is more psychological.
So bila kita lihat another perspective of the mind, dari segi perspektif macam agama and everything, you see it's always dah already indoctrinated that macam onani ni kita macam berdosa. So bila something like this dah already cue in the head, and then tabiat tu dibawa, and then individu tu perasan that you know what, I think I memang excessive buat benda ni, and bila datang kepada situation where they have a partner ataupun mereka akan masuk ke dalam alam perkahwinan or something like that, they then put a lot of weight on their mind that you know what, I'm this massive sinner, and because of this I have this curse. I kena sumpah I akan baca awal. So this thing is brought ke dalam kamar, and again it traumatizes the brain, because again sympathetic overdrive causes ejaculation to happen. So sebab tu bila some people say, you know why certain religious perspective say like, you know what, jangan everything, because why, when you try and you feel it so nice and you don't know how to have any form of discipline,
you will do it.
You will and nowadays it's added on with benda yang tambahan, bukan saja onani, tapi onani bergantung kepada external factors. VR lah, ASMR lah, pornography, all this is
just so that they don't misunderstand. We are not saying that masturbation is wrong. Okay, but doing anything in moderation is good. Let's keep it that way. You do anything excessively, then it's going to bring you problems.
When you're young, you're experimenting with your body. Masturbation,
that's normal.
Everyone does that. It's normal as long as you have already you already understand what your sexuality is. Lepas tu you dah biasa dan you tak bergantung kepada benda tu untuk macam hari-hari dan sebagainya, then it's okay. We're not telling it's wrong. Right.
True. And some of the medications yang macam we know, like this excessive use of like things like tramadol and everything, memang dibanyakan negara luar negeri, antara benda yang mereka gunakan untuk rawat is gunakan opioids. Dan kita tahu opioids ni memanglah kalau ambil secara secara keterlaluan akan menyebabkan addiction. Dan kita akan cipta lagi satu masalah sekiranya Bagi je lah, bagi di sana to fix the problem. Tapi bila kita cuba rectify satu problem yang kecil dengan ubat yang macam ni, and then pada jangka masa yang jauh, in a long term, ada banyak kesan-kesan
Walaupun
lain.
tramadol dalam klasifikasi ubat opioid ni yang paling rendah kalau tak silap saya. Tapi kalau dikatakan nak guna untuk jangka masa yang panjang memang boleh menyebabkan addiction lah. That's for sure.
Nanti disebabkan kalau tak ada ubat tu pun akan dicari ubat tu untuk dapatkan.
Sebab nak bagi tahu tramadol ni kalau untuk long term kalau you gunakan, dia ada feel good factor macam opioid punya factor. Reduce stress, you rasa macam lepak, relax dan sebagainya. Compounding effect dia lebih lama lagi, tapi you akan feel you are getting there. Bukan saja daripada ejakulasi pramatang, then later everything else. And when you don't get it, you jadi macam fidgety. That is addiction, and that is very high in opioid users.
You start having withdrawal
symptoms and all those.
Nasib baik Malaysia ni mungkin benda ni agak terkawal. Kita tak boleh macam membekalkan sesuka hati. Tetapi sometimes we also fear that shopping takes place. Jumpa Dr. A ambil ni, Dr. D kata sakit badan, I will ambil ni. Every time they go and hunt for this kind of
But I think we can unanimously agree that starting tramadol for premature ejaculation is no. So kalau anda diberikan pil yang kuning hijau atau hijau dan nama dia tramadol dan sebagainya, ada dol kat belakang tu, pastikan you tak beli itulah. You tak ambil.
Tramadol.
Dia bukan Panadol lah.
Itu dol lain.
This one is a opioid. So before we wrap up, what tips yang Dr. Kevin ada untuk bagi nasihatkan kepada penonton di luar sana berkenaan dengan isu ni? Adakah something that kalau you ada isu ni, maksudnya everything is hancur, habis, close shop, ataupun memang ada rawatan, memang ada banyak perspektif yang kita kena pertimbangkan?
Of course, if you come into the perspective of kalau anda mempunyai pramata ejakulasi, of course there is tips, techniques, exercises and also medication. So it is not the end of the world lah, guys. Please remember this, okay? So if you have any problem with your PE or your girlfriend ke or your wife ke, ada making any issues ke, you pancur cepat and everything like that, please come and see V4 or any doctors nearby you, okay? We will try to help you. Don't worry about it, okay?
Liban?
Okay, so like what Dr. Kevin said, ejakulasi pramatang ni bukan satu masalah yang tak dapat ditolong lah. Okay, it's not like you said, it's not the end of the world. First, of course, you kena tahulah you ada masalah ataupun tidak. Yang kedua, you should be able to speak about it. So, bincang dengan your partner, isteri ke, your girlfriend ke, whoever it is, alright. And then dapatkan rawatan yang wajar, jumpa dengan doktor. Ada rawatan yang khusus yang boleh digunakan lah, instead of beli barang-barang yang tak
cuba-cuba,
nak cuba-cuba sebab just because dia murah. Sebab okay, kalau dia murah dan dia tak mendatangkan apa-apa musibah kepada you, tak ada masalah, nasib lah. Tapi kalau benda tu, contoh kalau you allergic kepada tu ataupun benda tu berbahaya, then who's going to pay for the damage, long-term consequences? So lebih baik jumpa dengan doktor. Dan satu lagi, jangan takut, dia bukan semuanya kena jumpa doktor. Ada beberapa masalah yang you, contoh ejakulasi pramatang juga, antara sebabnya yang you boleh jumpa dengan psikologis. Psikologis pun dapat memberikan rawatan yang bagus, yang mencukupi, yang mungkin tidak dapat ditawarkan oleh doktor.
Betul.
So you be open to all possibilities.
Correct.
And we will guide you. Kalau kita boleh, kita rawat. Kalau kita rasa lebih kepada psychological issues, then kita refer kepada psychologist yang betul.
Anything else, Sashi?
So this is the thing. Again, I think back to the same thing yang kita katakan masa ED sama je. Pastikan your lifestyle, kalau nak katakan dari segi pathological, kita kena buang faktor patologi ni dulu. Salur darah yang lebih baik, stamina yang lebih baik, exercise, your food, seperti yang kita katakan, your serotonin disebabkan oleh makanan yang boleh menyebabkan benda, your good bacteria, gut bacteria to be reduced, and this is one effect. Okay, correction of all this. Respect your body, have a mind-body connection. And then kalau nak katakan seperti masalah yang lebih, katakan you dah buat semua, you're fit and everything, tapi ada lagi masalah PE ni, mungkin you can do nerve ablation ke, go and see a urologist, or come and get this one from us, get the consultation from us. And like or maybe it could be simply fixed by a spray. We will determine it. Okay, benda ni is fixable. So this is the thing, basis. Respect your body. Come and don't be too shy. Don't be vulnerable. We're all men. We all have had issues. Everyone has had issues. We're not here to judge you. So dapatkan konsultasi pakar yang lebih ketahui daripada benda ni, and don't just simply go and buy stuff like what Kevin said. Yeah, don't try all this.
Yeah, I think just to sum up, I think respect your body ni sangat penting. Fahami badan you, merangkumi kesihatan pemakanan, merangkumi kesihatan mental, merangkumi kesihatan fizikal, fitness, stamina, macam mana you bernafas, macam mana you control pernafasan you masa you tengah bersama. All of this sangat-sangat penting, and jangan terpedaya.
Yeah.
Dengan obsession, mungkin cerita kawan-kawan, obsession tentang pornografi, obsession tentang apa penjual-penjual, I call it the black market operation lah, di mana you rasa macam vulnerable, that dia akan selalu kata you tak power, you perlukan benda ni. So it's like all this kind of negative kind of selling. They tell you that you tak power.
Yeah.
And then you feel like, alamak, you rasa macam orang mereka akan show, dia akan jual 10,000 produk jual and everything kind of thing. And then you feel like, if I'm not FOMO, fear of missing out.
Yeah.
So this FOMO issue nampak sangat, and benda ni sangat-sangat serious among our population, that mereka terpedaya dengan this
Especially with whatever's in your hand lah, your handphone lah.
dopamine.
Constantly scrolling.
Actually, hunting for something that hope a magic will happen. Hope one magical video will fix that.
Change your life.
Yeah, no, this is the magical video. Okay, sekian saja untuk episod kali ni. Semoga again, thank you for the good panelists. I think it's a very good discussion. Kita cuba bawakan naratif diskusi perbincangan kesihatan yang berbeza daripada yang the basic stuff. Semoga ni banyak membawa manfaat kepada semua, sehingga kita bersiar di lain rancangan. Kita lesung dulu.
Right.